Hi, my name is Jason Butts. I'm a lieutenant paramedic with the Castle Rock Fire and Rescue Department. This is Joe Dell. He's an engineer paramedic, also with the Castle Rock Fire and Rescue Department. Today we're going to be talking to you about pediatric intra-osseous infusion, or pediatric IO. When performing this procedure, the first thing that we need to do is make sure that we have all of our proper equipment. Joe's going to check, first of all, the saline that he's going to provide. He's going to actually provide normal saline to this patient. So he's going to check the clarity of the saline that he's going to provide. He's also going to check the date of the drug. Next, he's going to choose an IO needle. In this case, he's chosen the Jamshedi IO needle. From there, he will choose an IV setup. For this patient, since it's a pediatric, he's chosen the Buritrol IV setup. This will provide Joe the opportunity to manage the fluid that he gives to the patient and not fluid overload the patient. Next, he'll choose an extension set that he can add to his Buritrol setup. Next, he's going to choose a syringe and needle so that he can drop some fluid to make sure that he has performed the procedure once he has the IO needle in place. Next, he'll make sure he has some bulky dressing to hold the IO needle once the procedure has been done. He will choose his tape so that he can secure the IO needle. He'll also make sure that he has some type of a cleansing device. In this case, he's going to use an alcohol pad to prep the site that he will choose. We'll also make sure that we have a sharps container to dispose of our sharps in. And most importantly, Joe's going to make sure that he has the proper BSI, or body substance isolation equipment on. In this case, he's chosen gloves and goggles to work with. From here, Joe's going to set up his equipment. He's chosen the normal saline IV solution. He'll hang that, and then he's going to spike it with his Buritrol setup. Once he spikes it, he'll go ahead and fill the Buritrol chamber with approximately 30 cc's or 30 mLs of saline solution. Once again, that's so that we don't fluid overload the patient. Joe's now going to connect his extension setup, and he'll flush the line completely. Once he has the line flushed, he's going to take his syringe and drop some saline. Once again, this will provide Joe the opportunity to check the patency of his IO once he establishes the IO in the patient. From here, Joe's going to cut his tape so he's ready to secure the IO once he performs the procedure. Once Joe has determined the site that he wants to use, he's going to cleanse that site. And at this time, he wants to make sure that he's stabilizing the tibia while he's performing this procedure. He's going to remove his needle and make sure that he has that properly adjusted. From there, he's going to stabilize the tibia. He's going to insert the needle at the proper angle. He's going to perform a twisting motion. And once he feels or hears a pop, he will know that he's within the bone. He's going to secure his needle. From there, he'll remove the stylet from the needle and dispose of it properly. Now Joe's going to check that he has proper placement of his IO needle. He's going to aspirate to make sure that he can remove a small amount of bone marrow into the syringe. Once he sees that he has good placement, he's going to connect his administration set. From there, he'll adjust his flow. And then the last thing that Joe's going to perform is to secure his device. He's going to use his bulky dressings and his tape to secure the device to the patient's leg. Now that Joe has properly secured the device, that will conclude the pediatric intra-osseous infusion.